Hello, everyone. Welcome to week 8. I took care of my patient last week. My patient, this is her first time seeing my nurse practitioner. She moved into the area about 2 months ago, and her PCP referred her to my nurse practitioner. My patient is a 59-year-old Caucasian female who came ambulatory that day with her husband. When I asked her she was doing, she said she was happy. Okay, little background on my patient. She's the oldest of 5 children. She grew up in a healthy environment, she said. She has 4 other siblings who all live in the area with her. She has three children on her own. Unfortunately, all her children live out of state, but she said they are all close. She has been married for 40 years, and she said she had good relationship with her husband. All right, now we'll go to the mental status exam. My patient appearance appropriate. She well groomed and dressed appropriate for the weather. Her outfit is bright upon arrival. And when asked about her mood, she describes her mood as happy. She denied any depression, any hallucination, anxiety, mania, delusion, or hallucinations. Her speech is intact with logical connection. She followed the contents of the interview without any difficulty. She is oriented ×3. Patient denied any suicidal thought or ideation. She reported her sleep as good. She said she had been sleeping for anywhere between 8 and 9 hours most nights. She said she'd been trying to eat enough vegetables. For activities, she said she and her husband walked their dog daily for exercise, and then she said, vacuuming and taking care of the house as well. Okay, now we'll go to the DMS-5 axis. Axis 1, patient has bipolar 1. Axis 2, I would defer that. Axis 3, patient has hypertension, skin cancer, restless leg syndrome, and she morbidly obese with the BMI of 42.9 kilograms. Axis 4, patient's psychosocial environmental factors, she's doing good. She's been happily married for 40 years to her husband. She has three grown children who are supportive. She said she's close to her siblings and her parents. Her parents live in the neighborhood. She does not work, but her husband is a financial advisor, and she said they are doing very well. Okay, Axis 5, the global assessment functioning, I will give her 95. I think she's doing really good. Okay, what would be the plan for my patient? Before we go to the plan, we'll go over her medication. Her home medication, she's taking lithium 900 milligram daily, Haldol 10 milligram daily, Xanax 5 milligram PRN, BID for anxiety, and then trazodone 150 milligram nightly for sleep. Okay, the plans, she'll continue the lithium 900 milligram. She just started this dose like 2 weeks ago. She said she would originally take in 1200 milligram daily, but she started shaking, so and her lithium level a little elevated, so we are going to keep our eye on it. The next lithium level will be in 4 weeks. She'll continue the Haldol 10 milligram. The Xanax, my nurse practitioner is not big about benzo, so we are going to slowly decrease it. She's going to send her home with 0.5 milligram instead of BID PRN for anxiety, with the intention to slowly decrease it and DC it and change it to Atarax 10 BID for anxiety. She's going to continue on the trazodone 150 milligram for sleep. My references are the American Psychiatric Association 2013, and then Stoll's Prescriber Guide 2021. Thank you, everybody.